I'm going to show some hip rotations. This is also known as a controlled articular rotation or a CAR. Really what it means is I'm going to be taking my hip through a big range of motion, trying to explore what my hip is doing while my back is staying still. So I'm going to get on hands and knees. I'm going to take a ball here. I'm going to place that on my low back. I'm just looking for a relatively neutral position in the back where the ball can balance there. And then what I'm going to do is I'm going to work some nice slow circles through my hip, trying to keep that ball nice and stable. So I'm going to come here, I'm going to drive my heel up to the ceiling, trying to lift my leg. I don't want to arch my back. I'll feel that ball start to move, bracing through the core, and then I'm going to rotate out nice and slow. I'm going to come back, and I might do 5 or 10 in this direction, and then I'll change directions. And what you'll find, especially my patients with hip or back pain, is that as they go to reach up, they might extend at their back, or as they go out to the side, they start to tilt, and then that ball will come off. So they're trying to use their back to control their hip. And we, of course, want the hip to control the hip. And so what we do, if we go nice and slow, is you should start to feel some muscles working through all these ranges. And we can just kind of explore out here. There's no right or wrong way to go, as long as the back is staying nice and still. The slower you go and the higher you lift, the more work we're doing. And then also we can really drive up high here. I can straighten the leg a little bit, feel the glute. I can start to come out. This is also a great drill. Anybody who has some hip pinching or hip clunking, a lot of the dancers that I work with sometimes can have that. And usually it's a lack of control over some of these outer ranges of the hip. And so they get some clunking when they're dancing and they're in positions where they're coming out here because they don't have the control through those hip muscles. So we can practice hands and knees. We're going to just come out as far as you can without getting any pinching or clunking and come through there. And then eventually I could straighten this, and then dang, that's hard to come through. But all while keeping the back flat, core braced, because we want that movement to come through the hip, not coming from my other joints. So that's our hip controlled articular rotation. Of course, I would do both sides, but the ball can be a helpful tool to make sure you're truly moving through the hips and not through your back.